Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. And to continue the hairy theme, today I'm speaking on hirsutism. This one, unlike the last presentation, should be relatively short. So hirsutism differs from hypertrichosis. Hypertrichosis is from the Greek, and it literally means too much hair. Hyper, too much, and trichosis is hair growth, so too much hair growth. Hirsutism is actually different because it is an excess or an abnormal hair growth, but it's not an excess or abnormal hair growth of, say, the vellus, which is the baby-like hair, nor of the terminal hairs, which is like the hair on our arm. It's an excess or abnormal growth of hair in secondary sex characteristic type of hair. So hirsutism specifically applies to women because it's a male pattern hair growth and or hair loss. So secondary sex characteristic hair is hair that responds to testosterone. So that would be mustache, beard, facial hair, chest hair, think Italian or Greek grandfather with the gold chains. So chest hair, back hair is also can be testosterone dependent, lower belly, upper thigh, and then hair loss. So the male pattern hair baldness. So those are our secondary sex characteristic hair, or hair that develops post-puberty due to testosterone. Now, the unifying factor for hirsutism is that it's testosterone dependent. So it will either be an excess concentration or level of testosterone in the bloodstream and or an excess sensitivity of testosterone on the skin level. Now, we don't really distinguish the two dramatically because they look the same, they're dressed the same for the most part, but if there's an excess testosterone level, then we look to see if there's a neoplasm, so a malignancy, I'm going to say a tumor, benign or malignant, that's increasing testosterone production beyond what's normal or average for a female patient or for a woman. So that would be a neoplasm or a benign or malignant growth, an abnormal growth or tumor of the ovaries, and then potentially of the adrenals. For the most part, that's really not going to be the case. It's going to be just a little bit, so say 1 or 2% higher level of concentration of testosterone than what is average or normal for a woman will cause hirsutism, so male pattern hair growth and or hair loss. And predominantly, it will be normal levels of testosterone, but an increased sensitivity. So there's an enzyme on the skin level that responds to testosterone. It's called 5-alpha reductase. And that enzyme, if it's hyperactive, will increase the identification or will over-respond to normal levels of testosterone. So it will look like that person has increased testosterone levels, or that woman will have increased testosterone response, is what it is. Now, hirsutism is most commonly seen in a syndrome of polycystic ovarian syndrome, or PCOS, or what we used to call Stein-Leventhal syndrome, or Hair-Ann syndrome, a bunch of different names for the same syndrome, so through the ages. So hirsutism is often seen in that syndrome, but it can be seen by itself. We do have a blood test for 5-alpha reductase. A lot of physicians don't order that blood test because some of the labs it's difficult to order. Some of the insurance plans don't pay for it. And realistically speaking, if your testosterone levels are normal, there isn't any other phenomenon that can potentially produce the increased testosterone. So you've done an ultrasound or a sonogram, there isn't a mass on the ovaries. The testosterone levels are normal. There are a couple of other tests, so 17-hydroxyprogesterone, so you don't have a congenital adrenal hyperplasia that's potentially producing increased testosterone levels. You don't really need to check to see if the 5-alpha reductase level is elevated, because it is, and the treatment's going to be the same. So if all of your ducks are in a row and there isn't any excess production from an abnormal source, it's just an increased response to normal levels of testosterone, then you treat it the same. That's going to be 2 potential medications. The first medication will be birth control pills, because birth control pills will effectively reduce the circulating testosterone. So there's 2 types of there's total testosterone, so we measure how much testosterone is circulating in the bloodstream, and then specifically to see how it's affecting the skin, we measure the free testosterone, because the free testosterone is what the skin responds to. So birth control pills will reduce the free testosterone because it will increase a protein that binds that free testosterone. That's called sex hormone binding globulin. So you can measure sex hormone binding globulin also, but if it's low, the only treatment to do is to prescribe birth control pills, because they'll increase the level of sex hormone binding globulin, and it will effectively decrease the free circulating testosterone that the skin is responding to. In addition to that, you can prescribe, or a physician can prescribe, spironolactone or aldactone. And spironolactone or aldactone will decrease the skin's sensitivity or response to that now decreased circulating testosterone. Most physicians will prescribe both, because you'll get a double whammy effect. So you'll have normal testosterone levels that the person's overreacting to. Then you decrease the amount of free testosterone by prescribing the birth control pills. And then you effectively decrease the testosterone even more by decreasing how sensitive your skin is to that testosterone. So you do that double whammy of decreasing the testosterone that the skin is responding to. Now, the birth control pills will also do a little extra work, because they will decrease the propensity for more hair to grow. Once you've had a hair follicle grow, you can't eliminate it with medication. The only way to eliminate it is to undergo electrolysis, laser hair removal. Those are the only 2 potential modalities to eliminate that extra hair follicle. Waxing and other depilatory methods are very, very temporary. Electrolysis and laser hair removal are the most permanent. They're not 100% permanent, but they're the most permanent that can be attained. So I hope that was helpful information. I said this is going to be a short one, so this is short, helpful information on hirsutism. Hirsutism is an increased male pattern hair growth and hair loss. Oh, and as far as the hair loss goes, it's the same story. Birth control pills and spironolactone to arrest the hair loss and decrease the response to the testosterone in the scalp. And then it would be like minoxidil on that area to try to increase the hair growth. All of this can be done with either gynecologist who's comfortable treating hirsutism, and I'd assume most gynecologists are, I am, and or a dermatologist to treat hirsutism. So hirsutism versus hypertrichosis. Hypertrichosis is werewolf syndrome, or this increased body hair, like hairy arms and hair, thin, fine, baby-like hair on the face or on the chest or back. Whereas hirsutism is male pattern hair growth, so coarse, secondary sex characteristic hair like under the arms or the genital pubic hair, but in male pattern hair levels, and also that male pattern hair loss. Thank you for joining me at the corner today. Please make sure you check out not only Facebook and YouTube, but we're on all the platforms for the podcast, Spotify, Google, all of the usual haunts for podcast. And make sure you hit the like, subscribe, follow buttons, and give a thumbs up for the presentations you enjoy. Have a great rest of